Good evening, everyone. Thank you for joining us. Today is the very first Mental Health Action Day. It's a time set aside to focus on raising awareness about various mental health needs across the country and how to give people the help they need.
And experts say the pandemic has made the situation worse. WCBI Stephen Pimpo talks with a nationally recognized mental health expert today about how Mississippi can make progress in this field. Stephen is live in the studio with that report.
That's right, Joey. The latest data from the Mississippi State Health Department shows that just over 15% of those surveyed said they experience 14 or more days of poor mental health during 1 year. In talking with a doctor of psychology today, he told me there are both short-term and long-term steps he believes can make a difference.
To understand what to say to someone when they look at you in the eye and they talk about ending their life. Or what to say to someone when they look at you in the eye and say, you know what, I'm using again and I don't know how to stop.
Understanding. That's what Dr. Ben Miller, a nationally recognized mental health expert, says it will ultimately take to help end the country's mental health crisis that pushes many people to substance abuse, addiction, and death. Dr. Miller is the Chief Strategy Officer for Wellbeing Trust, a national foundation that advocates for advancements in mental and social health. He says the current mental health and addiction crisis existed long before the pandemic. COVID-19 has made it even worse.
We saw threefold increases in rates of depression and anxiety. Half the country described how COVID had had a negative impact on their mental health.
Their recent report tracks what they call deaths of despair across each state. Those totals are made up of the deaths induced by alcohol, drug overdoses, and suicide. From 2018 to 2019, Mississippi saw a 17% increase in those deaths.
If you look at Mississippi, you have a substantial portion of your population that is still uninsured. And one of the reasons that people do not seek out care is because of the affordability of it.
Baptist Behavioral Health Care here in Columbus features a chemical dependency unit and offers both inpatient psychiatric treatment and outpatient counseling. Dr. Miller says even more work needs to be done statewide to increase people's access to mental health treatment. He says the first step involves being proactive, especially in schools.
And we can better prepare our students to understand how to address issues of emotion, how to regulate those emotions when they feel too much. It's what we would call social emotional development.
He says the other piece involves modernizing the mental health and addiction treatment system.
We can begin to look at ways to bring mental health to where people are. Places like primary care, schools, prisons, jails, libraries, barbershops, you name it.
He says the end goal is to not only be there for those in crisis, but to know what to do when you are.
Understand how to intervene with one another rather than just empathize and reflect back on how hard it must be.
The National Suicide Prevention Lifeline is available 24/7 for people of all ages who need help. That number is on your screen. For more information on Baptist Behavioral Health Care, you can visit our website, WCBI.com.